It's my charge to talk to you about low testosterone and erectile dysfunction, and a lot of the points that Dr. McVeary raised apply to my talk as well. So first, let's talk about erectile dysfunction. If you're a man in this room, if you look to your left or your right, the man next to you likely has erectile dysfunction. Based on the studies, we know that men above age 40, about half of all men have problems with erections. So you are not alone, and of those with problems with erections, you have severe problems that won't go away by themselves in greater than half the time. We know that in 2025, the prevalence of erectile dysfunction will approach 322 million men worldwide. So in order to create an erection, you have a series of three things that need to happen. It's a neurovascular event. So first of all, you need to have stimulation, which is not shown on the slide. And then you have to have nerve tissues signaling the penis to tell the smooth blood vessels to expand. After those smooth blood vessels expand, blood flows into the penis, but that alone is not enough. The blood has to be trapped in that area. If I show you a cartoon, I'll show you in a second how that needs to be trapped. But in order to facilitate blood flow into the penis, a lot of times when we talk about blood flow in, there are three main things that we talk about. The smooth muscle has to relax in the penis and the blood has to flow in. And here you can see other causes why there would be problems with erections. But getting to the point of the blood being able to have to be trapped, if you look at the penis when it's not erect, and this is in this picture here, you see these blue veins on the outside, and these are not under any control by the body, but they essentially passively are compressed when an erection occurs. So in this picture, you can see that an erection has occurred and these blue veins are being compressed. As we get older, those blue veins in the penis become more rigid, harder, if you will, more like PVC pipe. And so if you aren't able to compress those veins, then you get what's called a venous leak. And again, the erection gets soft, as would be shown in this cartoon here. The point is that this is an integrated process of many, many things, and we can address all these problems. Let's talk a little bit more about some of the science of this stuff. Now, this is a very kind of difficult slide to understand without context, but this is a study from the Mayo Clinic in 2009, I believe. And what they did is they followed men at about age 40 over time, and these men neither had problems with erections nor heart disease at the beginning of the study. It's a community cohort. And as time went by, a certain number of men developed problems with erections, a certain number of men developed problems with their heart. In this study, this was defined as chest pain, an intervention, sudden cardiac death, bad stuff, right? So the main point of this slide is that when you look at young men, ages 40 to 49 and 50 to 59, here are incidence densities of guys who had heart attacks, so hardly any. And lo and behold, they never got erectile dysfunction. Compare it to the men who got erectile dysfunction, they were at a very, very high incidence of getting problems with their heart. This is the most powerful study I've ever seen to predict heart disease. When you're 40 years old, if you have problems with erections, you are 52 times a higher chance than your twin brother who doesn't develop problems with erections to have problems with their heart. So if you learn nothing else from my part of this talk, it's that you should consider your penis a canary in the coal mine. So of course, this is a picture of a coal miner here, and what they used to do is bring canaries down into the mine shafts. And when the canary stopped singing, i.e. died because of the low oxygen level, the humans would know that they needed to get out of the mines, right? Because they were going to die soon as well. So I would argue that the penis is exactly the same thing as the canary, and as long as the penis is singing and functioning well, you're going to be fine. However, once the penis stops singing, look out, okay? So indeed, the canary in the coal mine, erectile dysfunction predicts heart disease. And most of the time, it's 3 to 5 years before men first have their first heart attack after they first develop problems with keeping erections. So you've got a window of curability there, which was on the previous slide, which you can address. So when you think of the word ED, don't just think of erectile dysfunction, think about endothelial dysfunction. This is the main thing in the heart that goes wrong when heart attacks occur. Early detection, we know that the heart attack's coming if erections problems occur. Exercise and diet. Just like a heart-healthy diet is a prostate-healthy diet, I say the same thing about the penis. A heart-healthy diet is a penis-healthy diet. So exercise and diet will improve erections. That will also improve your chances of preventing heart attacks. And ED also means early death. Those are early deaths of the young people that we can prevent by pursuing this and knowing this. So let's move on to low testosterone. So another word for low testosterone is called ADAM, or androgen decline in the aging male. And it results from a low testosterone level. The problem with low testosterone is that it's often confused with normal aging or depression. So people think, oh, you're not getting out of bed, you don't have any energy to do anything, your sex drive is low. People mistakenly get put on antidepressants, where the whole time maybe the underlying problem was low testosterone. It also can result in problems with erections, decreased sex drive, energy, decreased muscle tone, and just feeling off. There was a recent study in Germany for guys with big beer bellies in their 70s, and they were put on a long-acting testosterone. They weren't told to exercise. They just were told to go about their business. And after they were put on testosterone, the mean weight loss was 15 kilos, about 33 pounds after 2 years, after being on 2 years of testosterone replacement. Testosterone itself helps with weight loss and body composition. It's very easy to test for low testosterone. It's a blood test, and then we can treat it very well with testosterone replacement. Here's some other data. If you take testosterone away from a man for 10 years, you're at a 44% increase of diabetes and a 16% increase of coronary artery disease, defined in this study as death or myocardial infarction or heart attack. Another study, same thing. You double your risk of heart attack if your testosterone is low. If you have heart failure, if your testosterone is low and you improve it, you get better faster. And overall, testosterone improves your coronary risk profile by a number of mechanisms. Here's a study from the VA, very famous. They basically just stratified men by testosterone levels, and they looked at how well they survived and what they died of. Turns out that guys that had low testosterone died sooner of heart disease and cancer. Guys that had normal testosterone survived longer, and the guys on the border were right in between. So how can we modify our lifestyle to actually affect both problems with erections, problems with prostate, and low testosterone? Clearly, stop smoking. I have argued for a long time that it should say this on the cigarette carton: cigarette smoking is hazardous to your erection. I think they should go further and put a flaccid cigarette on the carton as well, to remind men that this is a key way to help improve erections and testosterone. Follow a heart-healthy diet. We talked about that. Exercise regularly. Even modest exercise can significantly improve both testosterone level and erections. Weight loss, same thing. So our body changes as we age. Diet matters. Everybody knows that's the statue of David, but with the American diet, this starts to happen. And as you progress and eat even more, you end up there, okay? So the more you can shift from that direction back up to the ideal body type as defined several hundred years ago, your problems with erections, your problem with testosterone will improve, no question about it. Let's look at a little bit more evidence. So again, if you limit or avoid excess alcohol, that really doesn't affect things much with testosterone and erections. Unless you're really drinking heavily, it doesn't make things worse. That's good news. If you quit smoking, clearly your penis will get better and your testosterone probably as well. Healthy diet, exercise, weight loss, strong evidence that's helpful. Correction of low testosterone. Let's say you just have problems with erections, or you have problems with erections and low testosterone. If I give you testosterone back and you're a young man, your erections might get better on their own. However, older men who have problems with erections, they have more than one reason why their penis isn't working well. They've got heart disease, they've got high blood pressure, they've got high cholesterol. So just fixing testosterone will not fix erections. So I tell people with caution, when we're giving you testosterone, we may help your penis slightly, but the main point in giving you testosterone is for you to feel better, for you to normalize your sex drive and have more energy, so you can go and do the exercise that's necessary to make actual true improvements. Treatment of high cholesterol has moderate evidence that actually helps with erections and testosterone. Treatment of hypertension is the one condition where if you treat it, it actually gets worse, because some of the side effects from the medications that we give actually cause problems. So if you're on an antihypertensive medication, we can work around this pretty easily. And if you have type diabetes control, there's moderate evidence that will help with both erections and testosterone. So here's a pictorial review of how we can treat this. The bottom line is that there is no reason why you can't have your problems with erections treated. There is a treatment for every man. As long as you are healthy enough to climb up a flight of stairs or buy your own groceries, you can have your erections fixed and you can resume normal sexual intercourse with your partner if you wish. However, it just depends on the level of commitment you have and what you're willing to do to achieve those erections. So we start out with pills, which everybody has seen on commercials. Next, we move on to vacuum pumps. These are very inexpensive devices that will work to give you an erection about 90% of the time when pills fail. There's shots into the penis, and every time I mention that to patients, invariably they make a face. But it actually doesn't hurt, and it's very, very effective and very, very inexpensive. Compared to the cost of the pills, they're about a quarter of the price, $3 to $5 per shot, and they work very well. In guys that fail pills, again, they work about 95% of the time. Finally, there's something called a penile implant or internal penile pump. This is a surgery that takes about an hour. You would go home the following morning after it's done. And after you have this device in place, you can have sex whenever you want for as long as you want. This is actually a device which essentially replaces the inner lining of the blood flow, which we talked about before. It's kind of like replacing the inner tube in a tire. When people want to have sex, they basically will pump up this small pump in the scrotum, which is completely concealed, locker room proof as I call it. You get a firm erection, good enough for intercourse, and it stays hard as long as you want it to stay hard, and then you hit a button to release the valve, and it becomes flaccid again. This is natural erection. It has the same sensation, and it has the highest satisfaction rates of any of the different treatments I've described. For low testosterone, we can either give you shots once every couple of weeks. We can give you medications, which you apply to your skin in the form of a gel, which replaces your low testosterone level. Or we can put in these little pellets called Testapel, and there's the actual size compared to a penny. You come in every 3 or 4 months, and that replaces your testosterone. Pretty easy to do. So in conclusion to my brief section of this talk, we know that problems with erections predicts heart disease. Don't forget that. We know that problems with testosterone predicts heart disease. You can affect both erections and low testosterone by making significant lifestyle changes. And indeed, if the lifestyle changes aren't enough to make you happy, we have excellent treatments for both of these conditions. With that, we'll save questions for the end and move on to our next speaker. Thank you.